Good afternoon. These are difficult times for all of us, and it's going to get more difficult in the weeks ahead. And the only way we are going to be able to get through this is to do it together by staying apart and preparing our healthcare system to respond. Across Canada, there have been more than 6,000 cases of COVID-19 and 66 deaths. Today, I'm confirming 7 new positive cases of COVID-19 in Prince Edward Island, bringing our total to 18. These 7 cases are related to travel outside of the country, further highlighting the importance of following self-isolation. These cases 4 are female, 3 are male, ranging in ages 1 in their 20s up to 2 in their 70s. My office or I spoke to them this morning, and they are at home and doing well. As we continue to see our numbers in Prince Edward Island grow, I will continue to stress the importance of social distancing, physical distancing, as well as social isolation. And for those who are not self-isolating, the physical distancing or social distancing, and we're using both of those terms interchangeably now, it's trying to keep that 2 meters apart. And that physical distancing is important for everyone who is not self-isolating. It is really critical in order for us to slow the spread of COVID-19 here in PEI. And I want to make sure everyone understands what we're asking of Islanders when we speak about physical distancing. Let's start with the fact that everyone needs to remember to stay home as much as possible. If you do need to leave the house, you should practice physical distancing. This means that if you're at the store getting groceries, if you're picking up a prescription, or other things you may need, you are keeping 6 feet between you and others. And certainly over the weekend, it was reported to me and apparently on social media, at times when people were not practicing physical distancing. So what is not part of physical distancing needs maybe to be clarified. Physical distancing is not going to visit family and friends. It's not having people over to your home. Physical distancing is not meeting up in groups outside. Physical distancing is not grocery shopping in groups. Physical distancing is not having play dates with other children. And physical distancing is not having coffee with a friend. I, too, would love to do many of these things, but now is not the time. Right now, the best way we can show our love and appreciation for others is to protect them by staying apart. Over the last weekend, we have strengthened screening measures at Confederation Bridge. With our colleagues from Highway Safety, we are gathering additional information from travelers entering our province. We're asking not only names and contacts, but where they have come from, and if they have a support system to help them gather supplies and support them while they're in self-isolation. And it is trying to get the messages across. Upon entering the province, it is important to self-isolate immediately. This means you do not go to the hardware store, not go to the grocery store. And if those arriving do not have a support system in place here to self-isolate, they should not come. We have almost 600 tests back, which are negative to date, and we are hoping that that number of tests that we have been doing will increase substantially in the next week or 2. Our cough and fever clinics have been expanded, and the new Charlottetown location is operating and has the capacity to screen and test more people, and the Summerside clinic opening today. And I know Marion will speak more on this. Anyone who is exhibiting symptoms of COVID-19, regardless of travel history, will be tested. And the reason we're doing this is that although we have not seen the community transmission here to date, it is definitely increasing across the country, and we're worried about the same, and we're looking for it. The sooner we can identify cases, the easier it will be to do contact tracing and self-isolation. We continue to receive calls from concerned islanders reporting others who are not self-isolating as required after travel. Since the toll-free number went into place, we've had probably close to 2,000 calls, over 900 a week in the last couple of weeks. Enforcement officers have been out over the weekend following up on those who are not self-isolating as required. Over the weekend, there were 56 complaints, 26 homes were visited, and 12 verbal warnings and 9 written warnings were issued by our enforcement officers. If we want to gain control over this pandemic, we need to maintain a high degree of self-isolation and physical distancing. This is not just a suggestion. This is what we all need to do. I'd like to note that the government has indicated that they're looking at options, temporary options for housing accommodations for those who may not be able to self-isolate without support. I found this note written by one of my children when I came home last night. And in closing, I am going to read what it says because I think it captures a lot of what we've been talking about and what we should be thinking. And I quote, "Please, PEI, if you need to be in self-isolation, stay inside. It is hard, I know, but please try, because it will stop the spread, which could save your neighbors, friends, and elderlies from getting COVID-19. If you don't, maybe someone's grandmother could die, which isn't nice, and you would not do it on purpose, but it could happen if people are not self-isolating. I want my mother back, but I am happy to share her. So please stay home if you need to, and you could be saving a lot of people by doing just that. P.S. If you need help getting stuff, just ask. As I said, there is good in everybody." Thank you. Je vais faire les commentaires en français et après ça, je vais donner à Marianne. À travers le pays, il y a plus de 6 000 cas positifs de COVID-19 et on est rendu à 66 morts. Je vous confirme 7 nouveaux cas de COVID à Lille. Il y a actuellement 18 cas au total. Ces cas sont directement reliés au voyage à l'extérieur de la province. Je me répète à chaque fois que je vous en parle, mais l'auto-isolement, nous voyons que c'est critique. Quand je parle de la distance sociale, l'éloignement social, ce dont je parle, c'est vraiment la distance physique, dont je vais changer des fois les mots qu'on utilise. C'est tellement important pour le travail d'aplatir la courbe et de ralentir la propagation de ce virus. La principale chose à faire présentement, c'est de rester chez nous autant que possible. Si vous devez sortir de chez vous, pratiquez la distance physique. Et la distance physique, ce n'est pas une visite entre famille et amis. Ce n'est pas de recevoir des gens chez vous. Ce n'est pas se réunir dehors en groupe. Et ce n'est pas faire nos courses ensemble en groupe. La distance physique, ce n'est pas prendre de café avec un ami. Je sais que tout le monde veut en faire, moi aussi. Mais pour maintenant, il faut en pratiquer la distance physique. La meilleure façon de reconnaître les uns et les autres, c'est d'être solidaires et de garder nos distances. En fin de semaine, nous avons renforcé nos contrôles au pont de la Confédération. Nos collègues de la sécurité routière sont en train de rassembler plus d'informations des gens qui entrent dans notre province. Les questions que nous posent maintenant sont d'où ils viennent, où ils vont, s'ils ont un système de soutien pour les aider avec leur auto-isolement. Et lorsque les gens arrivent à l'île, n'importe qui, c'est important de s'auto-isoler tout de suite. Ça veut dire aucun stop à la quincaillerie pour faire le plein, même pour l'épicerie. Les cliniques de toux et de fièvre se sont agrandies. La nouvelle clinique en ville commence cette fin de semaine et puis aujourd'hui à Summerside. Et je vais laisser Marianne en parler davantage dans pas long. Toute personne qui présente des symptômes de Covid-19 sera testée, peu importe s'ils ont voyagé ou pas. Nous continuons à recevoir des appels concernant les gens qui ne respectent pas la consigne d'auto-isolement. Et aussi, on reçoit beaucoup d'appels sur la ligne 1800 et depuis qu'on a commencé, presque plus que 2000 appels. Si nous voulons contrôler cette épidémie, nous devons respecter les consignes d'auto-isolement et de distance physique. Ce n'est pas une suggestion, c'est impératif. Hier soir, quand je suis revenue chez moi, j'ai vu quelque chose qui est écrit par un de mes enfants et puis je pense que ça donne le message que j'espère que tout le monde écoute. Je vais le lire. S'il vous plaît, aux insulaires, si vous devez vous isoler, restez chez vous. C'est difficile, je sais, mais s'il vous plaît, essayez de le faire. Parce que ça va arrêter la propagation qui pourrait sauver la vie de nos voisins, de nos amis, des personnes âgées. Si vous ne le faites pas, la grand-mère de quelqu'un pourrait mourir. Et ce n'est pas sympa. Et ce n'est pas quelque chose que vous feriez par exprès. Mais ça pourrait arriver si les gens ne s'autolisent pas. Je veux ma maman, mais je suis contente de la partager avec vous. S'il vous plaît, restez chez vous si vous avez besoin de faire ça et vous pourriez sauver la vie à plusieurs personnes en faisant ça. En se passant, vous avez besoin d'aide pour aller chercher des trucs, demandez-le. Le monde est naturellement bon. Merci.
Good afternoon. I wanted to start today with a reminder to us all of our top priorities as a joint response to this pandemic from the Department of Health and Wellness, Chief Public Health Office, and Health PEI. Two of them are to reduce the level of illness and death related to COVID-19 on PEI, and the containment of any potential suspected or identified cases. We've been using this time leading up to the increased cases on PEI to expand and train our healthcare workforce and adjust our services. We're increasing our capacity and ability to complete and provide testing for COVID-19 for islanders. We're adapting and equipping our facilities to treat and isolate patients with COVID-19 while protecting those patients and residents who have not been exposed. This includes a phased approach as we begin to see an increase in cases in PEI. In order to achieve these priorities, we have asked a lot of people. As a health system, we've shifted our focus to controlling COVID-19 and attacking this virus. We're asking staff to move their thinking from what they do every day in supporting individuals and families who are needing care to also now clearly focus on what's best for the greater good in this public health emergency. We continue to receive an enormous response from retired employees and available volunteers and professionals from the community across PEI. We now have more than 200 people standing by, ready to help when needed. This includes nurses, doctors, respiratory therapists, physiotherapists, volunteers, and many more. Please don't worry if you are on our list and have not yet been called to come to work or volunteer. As our response grows, We have been connecting with specific resources as they are needed. Thank you for your offers of assistance and support, and we will be in touch, I'm sure. I've said it before, but it's worth repeating that our most important resource during this pandemic response is our people. The protection of those providers and our public is paramount for our response, and the supply and use of personal protective equipment is an important concern for our staff and physicians, as well as our joint response team. We will continue to do everything within our ability to have the supplies we need as we face this pandemic. This includes conservation measures as well as reaching out to other provinces and federal governments for emergency assistance. Our logistics team is making headway on alternative sources of personal protective equipment as well, and we're leaving no stone unturned. I'm very pleased to report that with our access to the National Emergency Strategic Stockpile, we will be receiving a number of new ventilators, 26 in fact, that will greatly enhance our ability to have this equipment available to offer ventilation support for any patients who become extremely sick with COVID-19. We've also confirmed our order for 12 additional ventilators, which we expect to arrive late spring, and both of those are separate from the 15 ventilators requested through the federal government bulk purchasing opportunity. And as a reminder, we currently have 19 ventilators in our province and in our acute care facilities ready to go, which are maintained and checked regularly. I'll mention a little more about the cough and fever clinics, which began this weekend, and that National Emergency Strategic Stockpile Clinic began on Saturday in Charlottetown. It has a drive-through COVID-19 testing clinic as well as the cough and fever clinic for Islanders. It's open 8 hours a day, 7 days a week. And over the weekend, this clinic in Charlottetown tested 68 people and assessed over 25 patients. Our second cough and fever clinic will be open today in Summerside, and Summerside has already been offering the drive-through testing clinic, but will now have the cough and fever clinic available there as well. There were 24 people tested at the Summerside clinic this past weekend. Individuals with coughs, fever, or other flu-like symptoms can call their family doctor or nurse practitioner for a referral to the cough and fever clinic, or call 811 to be referred to that clinic. Thank you.
We'll open it for questions.
Nicola McLeod, CBC.
Hi, all. My question is for Marian Dowling. On the cough and fever clinic, once someone has been referred by 811 or their family physician, what is the process when they arrive on site?
So once they've been referred to the clinic from 811 or the family physician, they send the information directly to our staff, who are then contacting the individual to set up that appointment.
And when they arrive on site, do they go inside the building, or does someone greet them outside?
Oh, sorry. Thank you. I wasn't understanding your full question.
Okay.
So when they arrive for their appointment, the testing portion, if they need to be tested as well as being assessed, they come in with their vehicle and they stay in their vehicle, and there's wayfinding and direction for that to come into the building to be tested, and they do that in their vehicle, so they don't leave their vehicle for the entire testing clinic. For the assessment clinic, they do park and come inside the building at their appointment time, and then they are greeted by staff just inside the entrance, and then they're flowed into the several assessment bays that we have in place.
Great. And Dr. Morrison had mentioned that it will expand our testing capability. Do we have a sense of how much that will expand our capability?
Well, we've been able to meet the demand all along, and we've been growing and adjusting those clinics as we've needed to, with the direction shifting through the public health office. So we've really been able to meet the demand. I know right now we could likely increase it to twice the amount if we needed to, but so far we're just monitoring the numbers as they come in and doing everything we can to meet the demand, and we have been able to do that. So we can grow it further if that need arises.
Thank you. Laurent Rigaud, La Voix acadienne.
Oui, bonjour, Dr Morrison. J'avais une question sur les personnes qui sont en auto-isolement, puisque maintenant toutes les personnes qui arrivent au pont de la Confédération sont contrôlés. Est-ce que vous avez une idée du nombre de personnes qui sont actuellement en isolement à l'île du Prince-Édouard?
Alors, s'il arrive par le pont ou de l'avion, il doit être sur auto-isolement depuis un bout de temps. Mais j'ai pas le nombre qui ont passé par le pont la fin de semaine, mais je pourrais, si j'en ai plus tard, je peux vous envoyer le nombre. Mais la chose la plus importante que chaque personne qui passe, on est confident, on veut qu'ils ont l'information avec l'importance de s'auto-isoler et s'ils ont le support d'en faire, qui est aussi important.
Juste un follow-up par rapport à ce que vous avez dit en anglais. Est-ce que vous me confirmez que vous avez dit qu'il y avait eu 26 maisons visitées par les forces de l'ordre, 13 avertissements oraux et 9 avertissements écrits, c'est bien ça?
Je vais juste confirmer, je m'excuse, j'ai pas dit en français, mais on avait 56 personnes qui ont avoir des complaints et puis ils ont visité 26 maisons et ont donné 9, il y avait 12 avis verbal et 9 avis écrits.
Merci.
Merci.
Sean McDougall, Eastern Graphic.
Good afternoon, everyone. This question is for Dr. Morrison. You mentioned stepping up screening measures at the Confederation Bridge. I was speaking to someone who came across the bridge on Saturday, and they said that the staff that screened them weren't wearing any personal protective equipment. You know, they didn't have any surgical masks or face masks on. So I'm just wondering why the staff may not be wearing personal protective equipment there.
Well, I mean, just as we've said to other people, if you're healthy and out in the community, certainly the mask is not something that you need to wear, but it's important that the person who is sick has a mask. So if they're coming across anyone who has any symptoms of illness, they are giving them a mask. So I think that's important. We did talk about it even over the weekend with the staff who were there, trying to make sure that we also portray and exemplify what we think is important from an infection prevention control point of view. And so the mask issue has come up, and there's certainly, but it's really, our advice to everyone is if you're healthy, you do not need to wear a mask. Having said that, we are also, and I don't know if the person mentioned to you, they're trying to maintain a certain social distance away, and so they're sort of having to speak pretty loudly into the vehicle to get the information, and because that's also important, and not only to protect our staff but also the people in the vehicle. We have to remember that they're also outside and not in an enclosed space, and so there's more risk of for people in a vehicle transferring virus to each other than there would be for someone outside.
Okay, and just to follow up on that, are there any precautions that you are telling staff to take at all the entry points to the province, whether it be the Magdalen Island Ferry, the Confederation Bridge, or Charlottetown Airport?
Well, I think a lot of the passenger traffic from the Magdalen Islands Ferry has been discontinued, and so now it's really the airport and the bridge. And I think our messages absolutely are about hand washing, importance of hand hygiene to all of them, making sure that they are healthy when they are going to help screen other people, and maintaining that social distance, and that's really been a lot of the message to really our frontline staff and who have been standing at the bridge along with our highway safety colleagues all night at the bridge and late night flights coming in from the airport, and they are working long hours and all, as we all are, even in the healthcare delivery system, all in an attempt to keep Islanders as safe as possible. We'll also be, now that we're having more detailed contact information, not just on those who are sick, but on those who are coming in, we'll be doing follow-up calls to make sure that people are self-isolating, particularly if they are if we're concerned about them not having the supports they need to self-isolate here.
Okay.
Thank you. Tim Rosedale, Global News. Tim Rosedale, Global News. Stu Neatby, The Guardian.
Good afternoon, everyone. Question to Dr. Morrison. I wonder if you could tell me a little bit more about the 7 new cases, like if there's a date range from arrival to testing, and if we know if all 7 self-isolated upon arrival.
Yeah, so I don't have the date ranges in front of me. Most of these people were tested within the last 2 or 3 days, and it may vary by a day for some of them, and all of them did self-isolate and knew exactly the plan. They knew when they arrived they needed to self-isolate, and they did so on arrival. And I thank them, the ones that I have, the people I've spoken to, for doing so, and because they have protected others by making sure they self-isolated.
Okay. And I guess this might be one of those questions that just sort of keeps both of you up at night, but is there any way to measure how we're doing as a province when it comes to social or physical distancing, I guess, compared to any other province or any other jurisdiction?
I think, Stu, it does keep us up at night because I worry about all of us. I think it is early to tell the impacts of some of the measures we've put in place. I think we'll know more in the next couple of weeks. But I do know from the modeling that's being done elsewhere in the country and the numbers, if we don't do a really, really good job, then we will have more challenges in the weeks and months ahead than if we all make sure that we do good self-isolation and appropriate social or physical distancing.
Okay, thank you very much.
Thank you.
François-Pierre Dufault, Radio-Canada.
Oui, bonjour, Dr. Morrison. Question pour vous en français. À ce moment-ci, à quel niveau est-ce que vous évaluez le risque qu'il y ait une contagion communautaire d'insulaire à autre-insulaire, pas nécessairement liée au voyage?
Je pense que le risque va changer. Je suis certaine qu'on va avoir la transmission communautaire. On ne voit pas encore, mais j'ai aucune doute que ça va arriver. Et puis c'est pour cette raison qu'on parle jour après jour l'importance d'avoir la distance physique et sociale entre les insulaires. Alors le risque est assez haut que ça va commencer, mais à ce moment, tous nos cas sont reliés au voyage hors du pays.
Dans le même ordre d'idée, Dr. Morrison, on a vu au cours de la fin de semaine des insulaires qui pratiquaient la distance sociale d'une certaine façon, c'est-à-dire qu'ils étaient assis chacun dans des véhicules, dans des stationnements. Est-ce que selon vous, ça fait partie de la distance sociale ou si c'est trop à risque de se parler d'un véhicule à l'autre quand les deux véhicules sont stationnés à environ 2 mètres l'un de l'autre?
Oui, je pense qu'il faisait beau cette fin de semaine, alors je pense que beaucoup de les insulaires voulaient sortir pour, pour voir un peu de soleil. Je m'inquiète que j'entends les gens qui sortent de leur véhicule pour s'organiser ensemble pour marcher et c'est difficile de garder la distance sociale si vous en faites ça. Si vous êtes juste la famille qui sort, vous habitez ensemble, vous prenez la marche ensemble, loin des autres, il n'y a pas la même sorte de risque. Mais si vous gardez la distance, mais quand vous avez beaucoup de véhicules qui s'organisent ensemble, la prochaine chose qu'ils vont sortir et faire un groupe. Et ça, c'est où il y a plus de risques.
Merci beaucoup.
OK, merci.
Carrie Wynn, Ocean 100.
Good afternoon, ladies. I have a number of questions, actually. Can we just start with the bridge and the enhanced screening that's been there on the weekend, Heather? You say that it's not recommended for people to come that don't have that support system in place while they're here, but are the people that's screening there actually have the authority to turn people away?
I think that's a really good question. We've actually, we've had people who, when we've asked if they feel they're essential to come to PEI, have actually decided on their own to turn around.
Uh-huh.
They've decided, I don't think I really need to come, and they've turned around on the bridge. There's not been any occasion where, to date, someone hasn't. Who hasn't needed to come, who doesn't have supports to do so. And we are looking at some options. One thing would be to issue an individual order against that, for that person not to come. But we're exploring measures that would be under the Emergency Measures Act that would be enacted if needed. And at this point, I think, especially when we're collecting all the information from people and trying to make sure they have the supports for self-isolation, it seems to, at least initially, be working. But it's not something we're not considering. Carrie Wynn.
And just with a couple of questions with the 811 line and the cough and fever clinics and the drive-through clinics. So does everybody have to be screened through their family doctor or the 811 clinic before they show up? I know you said yes for the cough and fever clinic. Is that the same way for the drive-through clinic?
Carrie Wynn, at this point in time, it is. Now, that may change. It's been also to make sure that from a traffic flow point of view, it also works. Everyone, and the 811 number over the weekend, the callback time is less than an hour. So I think that has improved dramatically over the last couple of weeks. So I think people are being able, those appointments should be arranged, and really, if you call one night, you should be able to get in and be screened the next morning, or even if you're getting called in the morning, we should be able to get you in that day. So I think at this point it's like that. It could change. As we know, there's been so much that has changed quickly over the last week or two.
Thank you. Brian Higgins, CBC.
Okay.
Yes, Dr. Morrison, I'm wondering if you can just describe for Islanders more about that enforcement process that started over the weekend. Can you just explain how those 56 complaints came to be deemed worthy of investigating, why some were home visits, what's the difference between a verbal warning and a written warning, who is doing these visits, and where is this process going to go going forward?
So the enforcement piece is really working with our colleagues, police and RCMP, and the process certainly has been refined and will continue to be refined. But some of those complaints are coming in through our 1-800 line, and they are being logged, accumulated on a spreadsheet, and then shared with the enforcement. And then the police themselves are getting some complaints. Some of those complaints actually are more than one complaint on the same person. And so that's why there's the numbers reflect that, and they're really around the self-isolation. So some of them are. I'm not out there myself doing the enforcement, of course. That is by the enforcement officers. I don't have any details particular to each of the warnings, but I do think it's important that people know that it's happening, and that people are paying attention, and that they're calling in complaints that we think should be followed up, because it puts everyone at risk. So those complaints are taken seriously. I know our enforcement officers are doing so, and it may be a range of situations, and they've had to go back to people's homes sometimes more than once and make sure they find people home. And so I think we'll find out more details as we go, but we need that process. Although we're talking about enforcement, I think it's also important to emphasize that most Islanders, and many of us, are doing who are self-isolating, are doing exactly what they're supposed to do, and I thank you. It's also a time for neighbors to help neighbors. So those who are self-isolating, it is time for neighbors to help others who may need it.
And a follow-up question, Dr. Morrison. We have 18 cases now. Some of them are older, so to speak, than the newer ones. Can you give us some sense of the overall status of the 18 existing cases? Are some getting worse, or has anybody been hospitalized, for example?
So to date, no one's been hospitalized. One is considered recovered, one of the initial cases, and we'll be following closely, especially these newer cases over the next few days, and really hoping that no one gets worse and needs hospitalization. We've talked about it before. 80 to 85% of the cases are mild and are able to be at home and don't require more hospitalization, but some do, and that risk is more, as you indicate, for those who are older. And so I hope each one of our cases continues to improve.
Thank you. Travis Kingdon, CBC.
Hi, Dr. Morrison. There's people across the province who are kind of gathering on driveways or people's lawns or in parking lots, but maintaining kind of 6 feet of distance between each other, and feel that's an okay way to socialize. Is that kind of acceptable and safe?
Well, we're trying to get that message out that it's really not the time to do that. And I understand that we miss our friends, we miss our families and extended families, but as much as possible, being outside with your family is one thing, but trying to, as much as possible, not gather in groups. Of course, if you're walking by each other in the street, it would be normal to maintain the 6 foot distance and say hi, but not to stop for long periods of time and decide to have an hour conversation out there.
And what's the difference between the 6 feet and the hour conversation? Where's the kind of increased danger then in that that longer kind of exposure?
Well, I think it's just hard to continue. I mean, I pull that out. I think it's hard for people to stay physically distant from each other for long periods of time if you're out on the street, and we're also trying to say, stay home as much as possible, and it increases the risk if we're out for extended periods of time, recognizing that it is important to exercise and it's important to get fresh air, but trying to do so as safely as possible. We also need to use our common sense and but do so in a very safe way. This is our time, we keep saying. This is not going to be forever, but it will be a lot longer for all of us if we don't do everything we can now. So we're trying to give really good general guidance about population level guidance, and I know we're getting into lots of nuancing of individual cases and how do you message for everyone some really important things to make sure they get the important concepts out. And I think all of you on the phone have been really helpful in us getting that message out at a population level.
Just one last question. Is there any kind of...
Sorry, it's Carrie Campbell, CBC.
Okay. Hi, Dr. Morrison. I know there's some information up on the province's website for restaurant operators in terms of, I guess, some suggestions for how they should operate to try to minimize risk to their customers and their staff. I just wonder, is there any sort of outreach taking place? Are they being made aware of those suggestions? Are there site visits or anything happening, anything in that regard?
Hi, Carrie. So a couple of things. One, we have reached out, especially if we have any indication of some concerns around certain businesses who, of course, are doing maybe doing drive-through or takeout. The Restaurant Association, I know we were in touch with them right from the beginning, and to help us distribute some of the information. So, and it may be, as things change, it may be a good chance to continue to get some of those messages out, sometimes more than once.
Okay, and so you said there has been some site visits where there have been complaints. Maybe I was just wondering if there will be, what's happening with restaurant inspections, for example, through this, and whether there will be any sort of, enforcement side of this to try to make sure that these guidelines or whatever you would call them are being adhered to minimize the risk.
They will the inspections, the food premises inspections, which we do in normal, I call in normal times, will be done on a complaint basis, and they will be inspected in terms of, and there will be follow up on any complaint made.
All right, thank you.
Okay, thank you.
Thank you. Thank you, everybody.
Thank you.